Hello, my name is Dr. Gekenya Wamuya. I work as the Child Health and Nutrition Advisor at the Regional Center for Quality of Healthcare, Kampala, Uganda. Today we're here in Kenya. We are training on Helping Babies Breathe, and we are doing a training of trainers for nurses and midwives coming from health facilities and medical training centers.
While I observe for any signs of breathing, which I'm not yet to see, there is no sign of breathing. So I'll cut the cord.
The Helping Babies Breathe training is important because we have come to realize over the years that asphyxia is one of the major problems that children are dying from. Data available from over the years has shown that newborn care is not doing very well within the countries, and there is a need to look into this. The three major killers are infections, prematurity and low birth weight, as well as asphyxia. The procedures and training methods over the years have changed, and they need to become more competency-based. The type of training that we are having here today uses a mannequin that can be able to simulate breathing movements within the child, and it's a better method for being able to train those who are at operational level, as well as the students who are in medical training institutions.
So we'll wait for the birth of the baby. When the baby will come, we see the baby. We can see the baby. Here, the baby is not crying yet. I put the baby on the mother's abdomen. I thoroughly dry the baby to ensure that the baby does not lose heat. Dry the baby.
Recent data from WHO released in August 2011 shows that although the number of newborn deaths has declined over the years, the rate of decline in Africa specifically is very slow, and Africa is lagging behind. And one of the causes is asphyxia. Therefore, we players who are within the African continent need to put in more investment in this to be able to help these babies survive.
My name is Dr. John Washira. I am the clinical manager in charge of training at the Kenya Pediatric Association. Most newborns in Kenya, and by a large extent in Africa, they die of preventable things and very simple things like keeping them warm. Things like hand washing, they die of infections, which can be prevented by hand washing. Things like feeding, initiating breastfeeding. So by initiating breastfeeding, by hand washing and keeping these babies warm, we can save more than 50% of the death that we can reduce the death by about 50%.
Let me wash my hands. I wash my hands, wet the hands, apply to the soaps, rub the bags, the legs there, back and the back. Then I will wash in the hands.
1, 2, breathe, 1, 2, breathe, 1, 2, breathe, 1, 2, breathe.
My name is Laerdal Foundation. I work at the Kenya Medical Training College. I'm a midwife training the nurse midwives. In helping the babies to breathe, the golden minute is very important. That is the first minute immediately after delivery. And for us to save the lives of the babies, we really need to ensure that the babies are breathing. By simple basic techniques, we need to dry the baby, stimulate the baby, and if the baby is not breathing, then we need to clear the airway and keep the baby warm. If the baby is still not breathing, then we can just use the bag and the mask to ventilate the lungs. And in that effort, we will save the lives of the babies.
I'll hold him. I noticed that the baby has started breathing. If it has started breathing, it's no need to ventilate. Depending on the baby has cried.